that we have been resisting for a little while now, and we've got to keep resisting for a really long time. Yes, yes. I have been preaching self-care lately. I've been preaching a lot about patience and compassion to my own personal group. But I realized the one thing that I haven't been preaching enough of is hunger. And the idea of being hungry, because we cannot afford to grow complacent ever again. We have to want this change with every part of who we are. We have to show up. That's you guys. You showed up today. We have to stand up. And we have to speak up. So let me hear it one more time. What do you want? Healthcare. When do you want it? Now. Yes. And you know what that means? It means we have to push through all of the pain, all of the discomfort, all of the rain, through the disappointments, through the losses, through the victories. We have to stay hungry no matter what. We have to keep pushing, to keep wanting, to keep working, to keep resisting, to keep acting. You have to set the example for those around you. You have to inspire your communities to take action. And today is the perfect example of that. So thank you for showing up. One more round of applause for you guys. We wanted to kick off this event. We have a great selection of speakers, but we wanted to kick it off by reminding everyone here why it is that we stand out in the rain to stand up for those around us. We wanted to give you guys a friendly reminder of the reason behind this fight. So it is my privilege to begin this event by featuring a speaker whose experience in healthcare advocacy comes from a very powerful personal experience. Please welcome Leslie Boyd.
All right, what do we want?
Healthcare.
And when do we want it?
Now.
All right, I hope he hears us, because when you take away health care, people die. And I got to tell you, my son was born with a birth defect on my birthday in 1974. That birth defect turned out to be a pre-existing condition as far as the insurance companies were concerned. And so he could not buy insurance for any amount of money. They were allowed to pick and choose and say, oh, you might get sick. No, you're dirty. Go away. And that's what they did to my child. And so he couldn't get the care he needed because he didn't have insurance. And because he couldn't get the care he needed, he died. Now, his life meant nothing to Mark Meadows, Paul Ryan, or any one of those people. But it meant the world to me. Their kids are fine. They don't care. And my other kid is fine, and my grandkids are fine. But I care. I care about your kids, unlike these guys. And let me tell you something. They call themselves pro-life while they shut down women's access to health care. I see a Planned Parenthood sign there. Let me tell you something about Planned Parenthood. They save lives every day. When I was in my 20s and a single mother with 2 kids and nowhere near enough money and no insurance, and I got sick, I went to Planned Parenthood and they saved my life.
Affordable health care is
And it was
important
on
to
a
Native
sliding scale
Americans.
fee. I went every year.
There has been a great debate about the Affordable Care Act, ACA, or Obamacare, as it is also called. It's caused a passionate debate in our country among those who are for it and against it. But why is ACA important to Native Americans? Native American tribes have a government-to-government relationship with the federal government. There was a treaty signed between the federal government and Native Americans many years ago. The treaties kept the peace through exchanges and land deals that included provisions to provide health care for Native Americans. So the question is, why do Native Americans need health insurance since they already have received universal health care through a signed treaty? Although a treaty was signed, the fact is there is not enough money to go around to provide for the health care needs of the Native Americans. There has been a long history of funding shortfalls for our health care needs due to lack of adequate funding from Congress. In support of treaty obligations, the Indian Health Service, or IHS, was established in 1955, but it has never been fully funded to serve our population needs. Through the IHS, small clinics and hospitals have been built over the years, and health professionals have been hired to provide quality health care for Native Americans. But the IHS does not receive adequate funding to continue to grow and improve. When Medicare and Medicaid became law, IHS was allowed to bill for these services, which has helped increase funding to IHS facilities. This history explains why it's important to include Native Americans in legislation for the ACA. But why do Native Americans need extra or additional health insurance through the ACA? If you are Native American and your IHS healthcare facility does not provide specialty services, your ability to access care outside the system is based on how emergent the situation is. However, if your insurance through the ACA, you can get referred out to an outside provider who will bill your insurance for the services that was rendered. Moreover, the ACA permanently reauthorizes the Indian Healthcare Improvement Act, extending the authorized new program and services within the IHS. The marketplace provides new coverage options for many American, Indian, and Alaska Natives, but only members of the federally recognized tribe will receive certain consumer protection. There is no set enrollment periods for Native Americans, compared to one specific enrollment period for the rest of the population, which has actually been decreased now to 1 month and 14 days. It used to be 3 months. No deductibles or co-pays to patients as long as they get health care from the IHS. IHS facilities can bill ACA insurance companies for services provided to tribal members, thereby reducing the amount spent by one facility. We do not get fined for not complying with the mandate to have health insurance, since IHS is considered credible coverage. The ACA addresses affordable health care and insurance in a number of ways, but not limited to. People with a pre-existing condition cannot be changed more or denied treatment. There is no annual or lifetime dollar limits on care. There are new rules and regulations to stop price hikes. Women cannot be charged more than men. Young adults can stay on their parents' plan until they reach 26. Medicaid can be expanded. Medicare has cheaper care for seniors and less cost for hospitals. Doctors' rates will stay the same, and Medicaid doctors will see rates increase, including more incentives. President Obama wanted a one-stop shop for Americans. He wanted Americans to review their insurance needs and pick a plan that they could afford, with many different insurance companies to choose from. Insurances available on the marketplace are not worthless plans. They are high-quality plans that can be used at different provider networks and also in different states if that plan is selected. Do we want Native Americans to sign up for health insurance through the ACA? Yes, because doing so will increase our access to care and decrease the money that our tribe has to pay for specialty care, money that can be used for other tribal resources. It would also mean that patients who need specialized care and a wider range of medications have access to these benefits. The Medicaid program is one of the most important resources for Native Americans. However, half of poor, uninsured adult Americans, Indian and Alaska Natives, live in states that are not moving forward with the Medicaid expansion at this time, and as such will continue to face a deficit. When the Supreme Court upheld the Affordable Care in ACA ruling, it gave states the option to expand Medicaid, something that North Carolina has not taken advantage of. States that decided not to expand Medicaid, like North Carolina, have seen a decrease in revenue for patients who are covered by IHS. Tribal members receiving care through IHS tribal contributions and the ACA receive quality health care akin to Medicare for all that the rest of the population does not enjoy, but that we all should demand. All of the benefits of the ACA will be taken away if the ACA were repealed, and I'm here today to take a stand, not just against the repeal of the ACA, but also to advocate for Medicare for all, based on our personal experience with the system. At this time, I'd like to introduce Nilofer, and she will briefly give her perspective as a provider.
Hello everyone. Thanks for coming out today on this very rainy day. I'm Nilofer Couture, and I'm a clinical nutrition manager at Cherokee Hospital. And I'm here because as we fight to stop the repeal of the Affordable Care Act and all the benefits that it provides to us, not just those of us who are on the ACA, but also those of us who are not, we need to look also to the future of healthcare in this country. President Obama understood that the ACA was only a starting point. We need to envision a healthcare system closer to Medicare for all, because as Dr. Elizabeth Rosenthal wrote in her book, even though we live in the age of medical wonders, transplants, gene therapy, life-saving drugs, and preventive strategies, our healthcare system remains fantastically expensive, inefficient, bewildering, and inequitable. We should expand Medicare to include all age groups so that everyone has access to health insurance and receives care that they need without having to use the emergency room as their primary source of health care. We should not be denied health insurance because we have a pre-existing condition. A single-payer system would decrease administrative costs and provide more efficient health care for the price. Why is it that a test in the United States that costs $1,000 only costs $100 in Japan or Germany? We presently have a healthcare system that pays lobbyists to defend the status quo, that is broken and provides financial incentives to do more tests and pay for the most expensive treatments. I work in a healthcare system that Terry just described that is similar to Medicare for All, where our patients have access to health care, whether it is to see a doctor, a dentist, or a dietitian like myself. It is truly a one-stop shop for us, for our patients, in the most holistic of senses, because patients can be referred for any service, whether it be physical therapy, behavioral health, dental health, or vision care. Wouldn't it be nice if everyone had access to preventive health care, such as nutrition and mental health services, just as we have in the IHS system? Our patients have access to as many healthcare services as they need, and there are no limits to their care. I can schedule as many follow-up visits with any of my patients without having a health insurance provider telling me that I can only see them twice in a year. In a system of patient-centered medical care, the patient comes first, not the insurance provider. And this is important because as a dietitian and a certified diabetes educator, I provide diabetes education to patients and their families as often as they need it. Our patients don't have to worry about spending money on diabetes testing supplies or multiple medications or the most expensive insulin that there is out there, because they're all provided for them. All they have to worry about is taking care of their diabetes, which in itself is a very difficult task. But I realize that there are many patients with diabetes outside this health system, and you might be one of them here today, that does not have insurance because you could not enroll in the ACA because our state did not expand Medicaid. And you might go without testing your blood sugars or taking your medications because of the cost. When diabetes is left untreated, the consequences are life-threatening. Patients increase their risk for nerve damage, blindness, amputations, kidney disease, and early death. Wouldn't it be wonderful if we could pay for patients to take care of their health so we wouldn't have to see them in the emergency room with a blood sugar of 600? I have a friend with uncontrolled diabetes who is not eligible for the ACA and has a hard time paying for his insulin, which for him is a life-saving treatment. Every time I talk to him, I'm so thankful for working in a healthcare system where my patients don't have to choose between buying their medications or paying for their rent or for their food. Of course, the IHS is woefully underfunded, as Terry mentioned, by Congress, which is why Medicare, Medicaid, and the ACA provide additional revenues. If it were fully funded, it would be a sustainable model for universal health care. So therefore, I ask Mark Meadows to think of his constituents and to stop the repeal of the ACA. Repeal is callous and irresponsible and takes away health care from 30 million people. And it's not just about health care, but the security and peace of mind that comes with having health insurance. Repealing the ACA puts partisan politics ahead of the health, well-being, and the economic security of all of us. The only thing repeal advances is a political agenda. So thank you for showing up in this weather to call out Mark Meadows for not holding a town hall. And thank you for defending the ACA because millions of Americans are counting on it. Are you fired up? Are you ready to act? Please sign the postcards that have been floating around because we're going to send them to Mark Meadows. Thank you.
Like he doesn't know that hundreds of Western North Carolinians from dozens of counties across District 11 have joined forces to stand in solidarity today to stand up and fight back. So, when our neighbors are under attack, what do? When Native Americans are under attack, what do? When our children are under attack, what do? When our bodies are under attack, what do? All right, next up, we are going to share another perspective from two fabulous women who are small business owners from two very different counties in District 11. They're going to remind our congressmen through their stories that healthcare isn't just important for poor people or people that he thinks aren't deserving. It's important for every successful contributing community member of Western North Carolina. So please welcome Lucia Gerdes and Lauren Baxley to the floor.
Hello, my name is Lauren Baxley. I'm a member, thank you, of Common Ground WNC, a huddle group. And I am a co-owner of my family's business, Baxley's Chocolates in Sylvan, North Carolina. And I just want to share with you how the ACA allowed me to start my business with my family. My father, mother, and I opened our store 19 months ago. It was a dream which began with my grandfather and father making chocolate for fun in during a family holiday and continued as a shared family hobby for 30 years. As we all know, when you begin a business, you plan to take as little as possible from your country, or from your, that too, from your company for the first 3 to 5 years. You try to cut your expenses as much as possible, and I found myself transitioning from a job where I was lucky enough to receive health insurance as one of my benefits to having to educate myself about the ACA and the open market. Because my company only has 2 employees and we are family, an individual plan was my only option. After meeting with one of the wonderful healthcare navigators at Mountain Projects, I quickly learned the ACA would allow me to reduce my expenses while obtaining a plan which surprised even my mother, who has had a career most of her life in healthcare. The benefits were just what I needed: a low premium, low co-pays, and a deductible that I could manage. The ACA supported me in my journey as an entrepreneur. I look at it as a system that gives you a leg up and then allows you to give back. While my business grows and my paycheck is small, my premiums are low. As my business succeeds and grows, I will be able to take on more of my healthcare costs, and in so doing, I will add to the pool, giving new entrepreneurs a chance to fulfill their dreams. The chance to pay it forward. Without the ACA, I would have never started this endeavor. I am still struck with wonder every time I turn the lock to the door of my shop. I am able to make a living creating chocolate with my father. How lucky am I? And the ACA had everything to do with that.
Hi. Woo, it's really great to see so many people out here fighting for health care. I hope we can look back at 2017 and 2018 as pivotal to reshaping healthcare in America. My name's Lucia, and I own a cafe out in rural Transylvania. Our booming metropolis of downtown Cedar Mountain includes 8, you're laughing because you've been there, includes 8 small businesses who service the community in which we live in. Much of the 11th district is just like Transylvania, beautiful bucolic communities with picturesque downtowns filled with small businesses. The Affordable Care Act allowed people like myself, Lawrence, and many others across the district to become business owners. While we all know the Affordable Care Act isn't perfect, our elected representatives, many from North Carolina and the South, refuse to do their jobs and enact legislation that will protect us, our health care, and our jobs. We are the only industrialized nation in the world whose elected representatives believes health care is a privilege offered to the wealthy and not a right afforded to us all. Because of the Affordable Care Act, 23 million more people in the United States now have health insurance. And with that, right? And with that health insurance, out-of-pocket costs have been eliminated for preventative services, certain cancer screenings, contraceptive, reproductive counseling, behavioral assessments for children, and many more essential services. While we all know our premiums are too high and our deductibles are oftentimes unaffordable, we have to remember that the Affordable Care Act, before the Affordable Care Act, healthcare costs are rising 65% a year. Last year was only 20%. More importantly, because of the Affordable Care Act, coverage for pre-existing conditions is now guaranteed for more than 137 million Americans. But we have to do better. Culturally, we work harder, smarter, and longer than anyone else in the world, and as small business owners, we often do it for little to no money. We shouldn't also be the sickest. The messaging around the ACA continually tells us that it only helps the working poor, people without full-time jobs or low-income jobs that don't provide insurance. But in the 11th districts, it's the business owners and the economy that will suffer if Meadows has his way and strips us of our right to access health care. Small, family-run businesses are the economic engines of Western North Carolina, and we're people. We sometimes have pre-existing conditions, we often get hurt, and many businesses like Lawrence and hundreds of others across the district won't qualify for health care if individual protections are removed. As business owners, we're the farmers, the shopkeepers, the outdoor guides, the hairdressers, the massage therapists, the freelance writers, the restaurateurs, the artists, the substitute teachers, the experiential outdoor educators, the contracts, the laborers, and all the employees that help our businesses succeed. Losing the protections mandated and then gained under the Affordable Care Act threatens all the small businesses in the 11th District of Western North Carolina. I know my business and many others that make up my community will struggle to survive without access to health care. We've invested our money and countless hours of talent to create jobs in our counties and make Western North Carolina a place people want to live, work, and travel to. Our small business community is what's earned Asheville and other parts of the 11th District national media attention for being one of the best places to live and vacation to in the country. It's the small businesses. They're not coming for the malls and the Walmarts. Removing our access to health care inherently jeopardizes the ability of Western North Carolina communities to thrive. We keep hearing the Affordable Care Act isn't working, that it's broken. Our president is actually waiting for it to implode any day now. However, healthcare CEO executive compensation last year tops $20 million. And in their 2016 SEC filings, insurance companies announced record profits. The United Health Group reported operating earnings of $13 billion, 20% over last year. Aetna's 26 operating earnings were $2.9 billion. And Anthem, who runs Blue Cross Blue Shield, had a net income of $2.4 billion. Despite the fact that insurance companies are publicly recording better than ever, record-breaking profits, most of them have pulled out of North Carolina and many other states because they aren't profitable. But that sounds like politics and something our politicians need to fix. Our current representatives say our government simply can't afford health care. I say as a small business owner and an employer that we can't afford a highly polarized government that has little to offer its people in the form of health care protections because their loyalties lie with wealthy corporations. Health should not be ruled by cost-benefit thinking, but seen as a benefit extended to all Americans because a healthy, well-cared-for populace ultimately makes for a wealthy country. As a previous small business owner, it's surprising that Meadows cares so little about the rest of us in his district, the 44,500 of us who depend on the ability to individually qualify for insurance. He ran with a promise to repeal and replace the Affordable Care Act with common sense solutions that will improve healthcare quality while bringing down costs. While his support of allowing small businesses to form insurance groups sounds like a positive step in improving the Affordable Care Act and could help businesses like Lauren's and mine and some others, his plan to make insurance more affordable is really just a plan to lower insurance standards, reduce coverage, and dramatically raise costs. His plan does nothing to address the systemic problems that make medical procedures in the U.S. the most expensive in the world, nothing to make prescription drug prices more affordable, and nothing to address the fact that the insurance industry is a thriving multi-billion-dollar industry that does so by overcharging us and denying much-needed health services in order to turn a profit for their shareholders and pay multi-million-dollar salaries for their CEOs.
And why can't we not have health care for all?
We're getting that.
Company profit.
Right? Common sense solutions is what we all want. We all know it's cheaper to insure health than it is sickness, and it's time our healthcare policies represented that fact. America's healthcare, and more importantly our sicknesses, can no longer be profit centers for insurance companies. It's time we're no longer the wealthiest industrialized nation in the world without access to healthcare that's affordable. Needing a medical procedure shouldn't cost as much as a car, a house, or a year vacation around the world. Healthcare is not a luxury good, and we need to stop electing representatives who believe that it is. Healthcare insecurity stifles small business development, particularly in districts like ours, and is the #1 threat to my personal business. We need representatives who don't want to roll back the protections we've gained in the last almost decade, but ones who recognize free market healthcare solutions have failed us, and to acknowledge the only way to ensure affordable access to healthcare for all Americans is support Medicare for all. Thank
you, ladies! Mark Meadows may try to say that he is planning on lowering costs for his constituents, that he has this genius plan behind the scenes that's going to help everybody out, but are we going to be fooled by his scams? Are we going to let him use us to put more money in his pockets? We're going to stand up, we're going to fight back. progressive, organized women of Henderson County in bringing this event to life. Please welcome Christy Boyer. Here she comes. Please welcome Christy Boyer.
Wow, they forgot to tell me that I'm talking today. Yeah. So my story about ACA, I'm a small business owner, and 5 years ago, I was diagnosed with a pretty bad illness. I was disabled, and then my husband was diagnosed with pancreatic cancer. It was not fun. We were able to get on the ACA plan early. He had surgery, he's fine. I'm okay because I have ACA. Today, Mark Meadows wants to take all of that away from me. My employees are going to lose their benefits, I'm going to lose mine, and my whole business will be shut down. It's not a solution that he's looking for. He really claims that this is all about the Freedom Caucus. There's no freedom in losing my business. There's no freedom from putting my employees on unemployment. There's no freedom in death, and that's where we will all end up without ACA. Businesses can't afford to provide the kinds of costs that benefits are today. I'm glad to see everybody out here. It's raining. We've got a group of 700, or actually 800 wonderful members of POW in Hendersonville. Thanks for coming out. We just have to keep calling Mark Meadows and reminding him that we need this health care. It is not optional, and it never will be. So when we talk about when do we want health care, we want it now, but we want it forever.
Thank you, Christy. I do want to remind everyone, thank you again for sticking it out through this rainy weather. After the event, we are going to celebrate our victory and standing in solidarity with Healthcare for All down at Joe Sam Queen's office. We're going to have an after party with some drinks and some food. It's within walking distance, so make sure to stick around for that. We only have a handful of speakers left, so we are going to make sure that we show them how excited we are to fight for Medicare for all. What do we want? When do we want it? Awesome, awesome. Okay, and next I would love to introduce a physician out of Macon County, a healthcare advocate who played a key role in lobbying for the Affordable Care Act, who is here today to share his personal professional experience in the healthcare industry and providing healthcare services, and to talk about how imperative it is that the communities of Western North Carolina have equal, affordable access to healthcare coverage. Welcome, Dr. Ed Morris.
As we all know, last month Congress turned down the Trump Care bill, and the Affordable Care Act is still the law throughout this great land of ours. Now, this is great news, so let's take just a minute and everybody celebrate. Do a little dance. Yeah! Whoopee! Whoopee! Now, the failure of Trump Care is a ringing victory for patients, healthcare providers, and all the citizens of America. But you know what? We are thankful for each and every one of you who took the time to call your congressman, to write letters to the editor, to tell your friends how important it is to get rid of that disastrous Trump Care bill. So give yourselves another big round of applause. We celebrate the Affordable Care Act along with 20 million people that for the first time have life-saving health insurance they couldn't afford before the Affordable Care Act was passed. But even as we celebrate here today, we must remain vigilant because we can never go backwards to the way we had before the Affordable Care Act was passed. And there are those in Congress, like our Congressman Mark Meadows, that still wants to repeal the Affordable Care Act and take away essential requirements that are now in place for all health insurance policies under the Affordable Care Act. At a minimum, we need to always protect these provisions in the law, that all insurance policies will have these 10 essential minimum requirements. And these are things like coverage for pre-existing conditions, coverage for women's health care, including pregnancy and delivery and care for the newborn, prescription drug care, and one that I think is really important is payment for preventive services. So we can get screening mammograms or colonoscopies and make a diagnosis where it can be treated and cured and not wait till it becomes fatal. And all of these provisions save lives and prevent unnecessary suffering. But Meadows is trying to eliminate many of these requirements. Are we going to put up with it? No! Now, another provision in the Affordable Care Act was that insurance companies could no longer have lifetime caps, which were often set at $1 million. Now, Trump Care would have done away with would have allowed insurance companies to have the lifetime caps. And many people, especially young people, think, well, I'm never going to have $1 million expenses for my family or for me. But let me tell you, just in my family, I have 2 members that have already reached that lifetime cap. And I'll tell you about one of them. I know you can't see this, but this is my grandson, 2.5 years old, Weston Lee Morris. And he is my grandson, but he's probably a lot like your grandchildren or your children. He is the cutest, smartest, happiest little 2.5-year-old that's ever lived on this planet. But unlike your children, probably, one thing, he has a beautiful little twin sister, but he was also born with just one lung, and he had a heart defect. So he required multiple procedures the first year of his life. And he would have reached that $1 million cap, and without having insurance that didn't have that cap, he wouldn't have been able to get the other 3 procedures after he had reached that $1 million cap. So if that had been in place, he may not be with us here today. And if he had been able to get those, almost certainly his family, his parents, would have gone bankrupt. So we need to make sure that we never return to insurance policies that allow those caps, or yearly caps either. And again, Mark Meadows wants to allow insurance companies to go back and sell any kind of policy they want. Now, let me tell you about another lady from Franklin. She was changing jobs, and this was over 20 years ago. And so during that period, she was without health insurance. Well, she developed metastatic cancer. And of course, this was long before they did away with pre-existing conditions. So she could not get any health insurance. Nobody would sell her a policy. So she went to a cancer treatment center, and they said, well, without the treatment that we can offer you, you'll almost certainly die. And we'll be glad to give you that treatment. But you need to come up with payment up front. And it's $150,000. Well, she said, well, I don't have $150,000. So their solution was, I think you ought to contact all of your friends, all of your neighbors, and have them put donation jars at the convenience stores so you can raise the $150,000. Well, of course, this was absolutely ridiculous, but she was able to find a another provider that gave her the treatment she needed, and she's alive now 22 years later. But this is the United States of America. Is that the way we want to pay for our health care, by putting donation jars at convenience stores? We can do better than that in this country. Now, with Trump Care defeated, perhaps we can all come together in a bipartisan way. Democrats, moderate Republicans, independents, Green Party supporters, all of us working together to support what was really the primary principle behind the Affordable Care Act, which is that all citizens have the right to affordable, quality health care. The Declaration of Independence states that all men are created equal with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. Now, the first of these is life. Without quality, affordable health care, we are denying our citizens their right to life. Do you agree that all our citizens have a right to life? Yes! Do you agree that all of our citizens have the right to affordable, quality health care? Yes! Rich or poor, brown, black or white, young or old, all deserve quality health care. Yes! It is not just a privilege for the rich. It's a right. Now, about 11 million of the 20 million newly covered citizens under the Affordable Care Act were covered under the Medicaid program. And Medicaid is not just for the working poor, but it's also for the disabled. And it's for our parents and grandparents that get coverage for needed nursing home care. Well, Trump Care would have cut $880 billion from the Medicaid program and then put a permanent cap on that. So this would have taken away coverage for 14 million of our most vulnerable, most needy citizens. Well, thank goodness that disastrous plan is gone, at least for the time being. Now, what was Trump going to do with all of that savings that he was going to cut from the Medicaid program? Well, he was going to give a $800 billion tax cut to the wealthiest people and the wealthiest healthcare corporations in America. Well, we can celebrate that those taxes are still in place, and they help pay for 20 million Americans to have the health care that they need and deserve. Now, how many of you are on, like me, on Medicare? Whoa.
Later this year, baby.
Well, if you remember, Trump promised not to touch our Medicare. Well, under the Trump Care bill, he would have cut a very important tax that was placed as a payroll tax on those richest Americans, those earning over $200,000. And that tax didn't go into the general budget, the general fund. It went directly into the Medicare trust fund. And because of that tax, the solvency of the Medicare program, which would have been insolvent last year, was extended 13 years. And now it will be solvent at least to the year 2029. Now, how many of you think we ought to, at the very least, keep our Medicare program intact? Well, with the Affordable Care Act standing strong for the moment at least, we can begin to think about how we can provide at lower cost even better health care for everyone. Now, if we compare our healthcare system to, say, something you ladies may see on HGTV, different houses, you know, they have different level houses. Well, if we were trying to provide a house for, say, a typical family, 2 adults and 3 kids, so 5 people, well, what would the Trump Care house look like? Well, it would have looked like a little pup tent down there with holes in the roof and no heat, no plumbing, no nothing. It would have been a total disaster. Well, what would the Affordable Care Act look like?
Little ranch house.
Exactly, a little starter house that was been pretty good. It's given 20 million people new coverage. It's had a lot of benefits. But it was never really our forever house. It was never really our dream house. Well, what would our dream house be like? Single-payer, universal health care for everyone. And a Medicare for all system would be the easiest path to go.
And the most efficient.
Now, of all the developed nations in the world, the United States is virtually the only one that does not already offer universal health care for all of their citizens. Now, when we look at countries like Great Britain and Canada and France that already have universal health care, what do we see? Well, they spend about half per person as we do on health care. Well, what kind of health care results did they get? They are way better than what we have. There was a study that looked at the 11 richest countries that already had universal health care and compared it to the United States in terms of health care outcome. Well, where did we rank? We were dead last, at the very bottom. Now, a single-payer system would save at least $500 billion per year by cutting administrative overhead. Administrative cost consumes 1/3 of our total current healthcare spending. Now, with that $500 billion, we could easily cover every citizen in the United States of America with quality health care. We can do better than we are now. We need change now. How many of you would support Medicare for all? Medicare for all! Medicare for all! Now, Medicare for all! Medicare for all! Medicare for all!
Medicare for all.
Now, if we all work together, we can make this happen. Now, how many of you are willing to work to give the United States Medicare for all? Well, thank you so much for coming today, and let's celebrate today, but also begin to plan and work for an even better healthcare system in the future. Medicare for all! Medicare for all! Medicare for all! Medicare for all! Thank you.
We have quite a few news stations here with us today, so let's make sure that Mark Meadows can hear what it is that we want. Medicare for all! Medicare for all! Medicare for all! Medicare for all! And I know you guys are getting antsy, wanting to move around. We are almost done. We've only got 2 more speakers left, and this is just the beginning of this fight, so make sure you stick it out with me. I would like to welcome a familiar face that many of you already know, a former representative for the 119th District, Representative Joe Sam Queen.
Thank you. I'll try to make this short. I appreciate everybody staying here in the rain and the cold. It is so important. Health care matters. Now, my part of this program is to say, what is North Carolina doing? All of us, pledge allegiance to the flag of the United States of America, and pay our taxes. North Carolina, you and I and all of our neighbors are paying $2.5 billion to the federal government every year to expand Medicaid. Our General Assembly, the Republicans leading this supermajority in our legislature, will not allow our $2.5 billion to be spent in our state for our neighbors who need health care. It's about an incredible, wasteful, hurtful public policy. We need to demand that our tax dollars that we are paying, this is not new dollars, we've lost 3 years, $2.5 billion, over $7.5 billion in the current legislature. Governor Cooper is fighting to expand Medicaid, so the $2.5 million we're paying this year is spent this year for North Carolinians. That's $500,000 more of our neighbors who are low-wage workers working hard every day, making $7.50 an hour or less, would have health care. We've paid for it. They don't have it. I'm a recovery ally. We have an epidemic of drug abuse and alcoholism and depression and mental health problems in our country. These people would have mental health services. They would have a recovery plan. They could be productive citizens. We've paid for the health care. Our General Assembly is denying it, throwing it away. $10 billion. Now it's about the health care. It's about our economy. What does $10 million sucked out of your economy do? Every $1 million is 10 $100,000 jobs. 10 per million. Every job you kill by sucking that money out of our community loses another secondary job. It's 2 jobs lost there. That's per million. That's 20 jobs per million. You multiply that out. That's hundreds of thousands of good jobs that our neighbors would have, providing the care for 500,000 of our fellow citizens. These new job holders that they're throwing away would pay over $500 million new taxes, new revenues to our state to help with education and all the infrastructure that North Carolina needs to be competitive. This is the most wasteful, ludicrous public policy I have ever witnessed in my entire life. That's a fact. We need to stop North Carolina from being so stupid. Yeah, you know, I will end this. Governor Christie, a Republican governor over in New Jersey, he expanded Medicaid in his state. The Republican governor in Kentucky expanded Medicaid in his state. The Republican governor in Arizona expanded Medicaid in their state. They say it's working great. It's making us grow. It's building jobs. It's helping our citizens. Why did we get all the stupid Republicans? I want us to fight for what's ours. Expand Medicaid. We've paid for it. We want it. When? Health care when? Thank you.
What do we want? When do we want it? What do we want? When do we want it? Amazing, amazing. And you know, today is the beginning of a really important conversation in all of our communities. No matter what county, no matter what part of District 11 you are from, no matter if you are a small business owner, or if you work in an industrial field, or if you are disabled and you're not able to work, if you've already served your time and you're retired, if you're fresh out of college like me and trying to figure out where you want to work, no matter who you are or what you do, we will fight for you. We will stand up. We will speak out for Medicare for all people, no exceptions. So in order to help provide a little direction from here on how we can continue this fight, on how we can get rid of deceiving, misleading representatives who claim that they want to work for us but don't even know what our best interests are, like Meadows. In order to move forward from here, I am happy to welcome one of my good friends, a farmer who grew up in southern Appalachia and now works with Our Revolution over in Asheville. Please welcome Matt Coffey.
Thank y'all so much. Can everybody hear me all right? All right, so I might be in the top 10% of the coldest people out here right now. I'm so cold, so I'm going to try to be fast so we can all go get warm and dry off. All right, so first of all, I just want to thank all of the amazing speakers that we had today that came and shared their stories with us. And I also want to thank all of the organizers that made this happen. I want to talk about that for a second. And usually I like to speak without notes, but there are so many of them that I had to write their names down. So this event was organized by the NC11 Coalition. This is a coalition of organizations from all throughout Western North Carolina. We have Progressive Nation WNC, the Women's Action Group, Progressive Organized Women, Stronger NC, Indivisible Cherokee Clay, Indivisible Graham, Indivisible Silva, Indivisible Highlands, Organizing for Action, Common Ground, Indivisible Madison, Indivisible Swain, Transylvania Indivisible, Transylvania Action Collaborative. We have Democratic Auxiliaries, the UNCA College Dems, the Buncombe Young Dems, the Yancey Young Dems, the Burke Young Dems, the McDowell Democratic Reinvention Project, Our Revolution Burke, and Our Revolution Asheville. And I probably forgot somebody, honestly, but that's more than 20 groups. That's more than 20 groups that have come together to fight for the things that are important to all of us. But most of all, I want to thank all of you for coming out here in the rain, standing out here in the rain and cold to stand up for healthcare. We've heard from a lot of knowledgeable people today, people who have positive stories to tell about the ACA. We've heard from people about what happens without the ACA, and I know that there is some legitimate criticism of the ACA out there. People that are opposed to it are happy to point out that insurance premiums have gone up, and that's true, and we need to do something about that. But the solution is not to repeal the ACA. Repealing the ACA and going back to pre-ACA insurance company free-for-all is not the solution. Now, at the end of March, Republicans had to pull Trump Care from the floor of the House because they knew they didn't have the votes. And we thought that bill was dead. We thought we had won that battle, and now, okay, let's move forward. Let's move forward towards universal health care. But just this week, just a couple of days ago, reports started surfacing that Mark Meadows, on behalf of the Freedom Caucus, is trying to broker a deal with Tom MacArthur, who's the leader of the Tuesday Group, a group of about 50 moderate Republicans in the House. He's trying to bring this bill back from the dead. Now, as a lot of y'all know, Meadows killed. He was a big part of the death of that first bill. He killed that bill because the Freedom Caucus wouldn't vote for it. But he did that for all the wrong reasons, y'all. He did that for all the wrong reasons. He did it because he thought it didn't go far enough to take away entitlements. Entitlements like tax credits so that people can buy health care. He thought $800 billion plus cuts to Medicaid just wasn't enough of a cut. We needed to go a little further. So he killed the bill. And this new bill that they're trying to push through now, they're talking about pushing it through before the end of Trump's first 100 days, by the way, which means next week, right? Which means within the next 6 days. This new bill pretends to be more moderate because they're saying, well, we're going to keep the essential health benefits in there, but that's a smokescreen because what it's really going to do is provide a loophole that will allow individual states to opt out of requiring insurance companies in that state to provide essential health benefits. And I guarantee you, North Carolina is going to be one of the, see Just Sam Queen shaking his, yeah. So North Carolina is going to be one of those states. And we're going to end up with a loophole that allows insurance companies to deny people emergency room visits, prescription drugs, preventive care, maternity and newborn care, basically all of the things that you buy health insurance for. It does. It really does. It does, but you know what? That's not even necessarily the worst part, because the bill is also going to remove the community ratings provision of the ACA, and that's the part that prevents insurance companies from charging people with pre-existing conditions more, or from denying them coverage altogether. And the people like Meadows are saying, very, very conservative Republicans in the House are saying, oh, but that's okay because we're going to have these high-risk pools. We're going to have and the reason that people in the crowd are grumbling, if you don't know what those are, is because we had them before the ACA and they didn't work. People can't afford those policies. In fact, a study was published just a couple days ago by the Center for American Progress. They ran the numbers based on the provisions that are going to supposedly be in this bill, and insurance premiums are going to soar for people with pre-existing conditions. We're looking at somebody with asthma seeing their premium annually go up as much as $4,400. That's over $350 a month. But this, I mean, that's bad, but it gets so much worse than that, because at the end of the spectrum, people with a history of metastatic cancer could see their premiums annually go up by over $140,000. That's $12,000 a month, y'all. So you explain to me how anybody in this crowd can afford to pay that kind of money for a healthcare insurance.
Why have insurance?
Why have insurance? So on top of this, the original bill, as I said, called for over $800 billion in cuts to Medicaid, and we have every reason to believe that this next bill is going to be even worse. So it's pretty clear at this point that the agenda of Mark Meadows and the agenda of the Freedom Caucus is that they would rather craft a bill that creates tax breaks for the wealthiest people in the country rather than a bill that provides health care to working class people, rather than a bill that provides health care to all of us. I think it's time that we put an end to this discussion altogether. We do not need a regressive pre-ACA healthcare policy. What we need to do is join every other major country on earth and stand up and affirm healthcare as a right for all of its citizens. What we need is Medicare for all. There's a poll that just came out a few weeks ago that said that at this point, 60% of Americans support Medicare for all, okay? And that includes 75% of Democrats, 55% of independents, and 46% of Republicans. Those numbers are all up from a Gallup poll that happened a year ago, right? And they're only going to continue to go up as long as we continue to do this. As long as we continue to come out, stand up, speak up, educate people, talk to our friends and neighbors, talk to people who don't agree with us, explain to them why this is important, explain to them why this will be more efficient, why this is a better idea, why we need to do this. Because we can spend half of what we're spending on healthcare just by taking this one step and moving to a single payer system. I have spent the months since last November, whatever free time I can cobble together in my weeks, and then also time that I should probably be spending sleeping, working with Our Revolution Asheville. This is a chapter that we started, a local chapter of Our Revolution, which came out of the Bernie Sanders campaign. And we grew pretty quickly in just a few months to become what I've been told is the most active and most successful chapter in the country. But Our Revolution didn't put on this event. Our Revolution plus 20 other organizations in Western North Carolina put on this event, because there are people all around Western North Carolina stepping up and doing that same work, and that's what we need to continue to do. Now, I think we need to do more. I do think that we need to do more than just resist. I think we've been resisting and resisting, but we reach a point where we have to do more than just fight back and just play defense all the time. I think what we need all across America are leaders who will stand up for the working class values that everybody in this crowd cares about. I think we need people who are going to stand up to the likes of Mark Meadows, people who only serve the interests of wealthy donors and who grandstand every week on TV for publicity, for their own benefit, at the expense of the people of their district. So I'm going to make an announcement today. My name is Matt Coffey, for those of y'all that don't know me already. I am 30 years old. I'm a former farmer, a grassroots organizer. I grew up here in Southern Appalachia, and I've been in Western North Carolina over a decade, and I'm announcing to y'all today that I'm stepping down as the director of Our Revolution Asheville to run for Congress in the 11th Congressional District of North Carolina against Mark Meadows, and that we intend to win in 2018. Now I know what some of y'all.
Cafe for Congress! Cafe for Congress!
I thought you wanted to give a speech. I was going to say, when I'm done, you can give a speech if you want to. And I'm almost done. I know we're all cold. So I know what some of y'all might be thinking, which is that we can't win in the 11th, right? The 11th is gerrymandered and we can't, well, that's what a lot of people have told me. I'm going to be the first person to tell y'all, I'm just one person. I can't do this by myself. I'm also not perfect. I've made mistakes in my life that I've had to learn from and grow from. And this is going to be a really, really major uphill fight that we've got ahead of us here. And I know what we're up against, which is a guy with a lot of money, a lot of GOP money, and a lot of super PAC money, right? But what's happening right now, all of y'all driving an hour, hour and a half, 2 hours to be here, this energy that we've seen since November is worth more, so much more, than any amount of GOP money or super PAC money and any amount of gerrymandering. Now, I want to tell y'all something real quick about congressional campaigns. I want to tell you, yes, we can.
Yes, we can! Yes, we can!
I really believe that we can. I wouldn't be doing this if I didn't. I want to tell y'all something real quick about congressional campaigns, because a lot of people don't know how this stuff works, and I think it's really interesting, and I think more people need to know about this. So my guess would be that everybody in this audience knows all about Citizens United, or at least a lot about it. I'll be one of the first people to tell you that we need comprehensive campaign finance reform. We need to do something about the fact that corporations can buy elections using super PACs. We need to do something about that. But even if we do something about super PACs, there's still a lot of other things that are very disturbing about the way that campaign finance works. And we've talked to our team has talked to a lot of consultants and strategists that have been doing this a long time, and they all tell me the same thing, which is that there is one thing that I should prioritize above all others, and that's sitting in an office for 6 to 8 hours a day, calling the wealthy 1% and asking them for $1,000, $2,000, ideally $2,700, which is the maximum amount that an individual can donate. Now, the thing about that is that sounds great, you know, if all you care about is getting elected, right? Except that as soon as you get to Washington, here's what happens. The DCCC, if you're a Democrat, or the NRCC, if you're a Republican, they give you an orientation and they say, hey, welcome to Washington, great to meet you. Tomorrow's your first day on the Hill, but instead of sitting in your office or going to hearings, what we'd like you to do is leave the building go down the hill to a row house that we own, sit in a cubicle, and spend 4 to 6 hours calling people and asking them for $1,000 or $2,000 or $2,700. That's no joke, y'all. Do you want to know why Congress has such a low approval rating? Do you want to know why Congress can't get anything done? Do you want to know why people like Mark Meadows care more about corporate interests than they do about people like us? It's because they spend more than half of their day on the phone begging the wealthiest people in America, the so-called donor class, for money. So I've had a lot of people tell me that that's what I need to do, and I've had people say, the Bernie Sanders campaign was great, but it was a fluke. By the way, I think $230 million and an average of $27 contributions is more than great. But Bernie Sanders' campaign was great, but it was a fluke. Or they say, congressional campaigns like Zephyr Teachout or Tim Canova, they raised millions of dollars in small donor, but you're not going to be able to do that in Western North Carolina. That's what I've had people tell me. Well, I don't believe them. And I also don't believe that you can spend your whole day on the phone calling the wealthy 1% to beg them for money and still pretend that you have any idea what's going on with the other 99% of the country, including everybody in this district and everybody in this crowd right now. So I'm here today to tell you all that I'm going to stand up. I'm going to stand up to insurance companies. I'm going to stand up to the health insurance industry, to the pharmaceutical industry, and say that we need Medicare for all. But I'm also going to stand up and say a lot of other things that are very unpopular with some folks in the donor class. I'm going to stand up and say, it is long past time, we need to raise the minimum wage to a $15 an hour living wage, so that if you work 40 hours a week, you're not living in poverty. I also want to stand up and say that if you want to get a higher education so that you can get a decent job, you shouldn't leave school in a crippling amount of debt. So I'm going to stand up and say that we need tuition-free public college in the United States. And I'm also going to stand up and say that we need massive amounts of infrastructure investment in Western North Carolina, especially because we need the jobs that infrastructure investment will bring to this district. And with your help, and with the help of people like you and I, just like us, from all around North Carolina and all across the United States, we're going to raise the money that we need. We're going to go all the way to Washington, D.C., and we are going to change the face of politics in the United States. So I'm going to wrap up here, but real quick, I want to take a page from Bernie Sanders' book, talking about all this fundraising stuff. Instead of hosting a fundraiser with $500 or $1,000 tickets, or instead of spending my entire day tomorrow on the phone asking people for $2,700, this is no joke, folks, okay? Instead of doing that, I think, we should just have a fundraiser right now. So anybody that wants to join our fight can go to coffeeforcongress.com and donate whatever you want, $10, $20, whatever you have. And we're going to take those small donations and we're going to show the political elite and the corporate elite what a grassroots campaign can do in the mountains of Western North Carolina. Like I said, I've been in Southern Appalachia almost my whole life. I love these mountains and I love the people of these mountains, and it's long past time that we stood up together and rose up, not just to elect people like me, but to elect people all the way down the ballot, all across Western North Carolina, who are going to stand up and fight for the interests of working class people and not corporations and not billionaires. The road is going to be hard, the road is going to be long, but I believe in us and I believe in all of you. This is going to be a really tough fight, but I'm ready to fight, and I hope you're ready to join this fight with me. Let's get to work, y'all. Thank you so much for coming out today.
Amazing! Coffee for Congress! and graduated from the university in Jackson County, Western North Carolina. As someone who has been involved in the local, state, and national politics of where I am from since the day I turned 18, I have never seen something as powerful and amazing as the movement that we are in the process of creating right now. And that's what it is, and I wanted to emphasize that. This isn't just a campaign. This isn't just an election, and it certainly isn't just a resistance. It is a movement. We are creating a new face, like Matt said, for not just politics, but for our values, for the way that we treat one another, and the way that we lift up every person in our community. So, give yourselves one last big round of applause for sticking all the way through it. Make sure everybody hears us on both sides of the street. What do we want? When do we want it? All right, please make sure to use the crosswalks. We are going to stay on the sidewalks and march straight down that way until you see the subway, and then you're going to take that street on the left, and the big blue Victorian house on the right is where the after party is. So we'll see you there. Come grab some beer, some wine, some water, whatever your flavor is, and let's celebrate the fact that we can all come together and stand in solidarity. Thank you.